Today, we're going to be talking to Jane Ashbrook and Diane Reid, who both work in the physiotherapy department at Manchester Met. We're going to be talking to Jane and Diane about the different pathways and career options available to students on the Advanced Physiotherapy course, and more specifically, the MACP pathway and the first Contact Practitioner role. So Jane, could you please give us a brief overview of your role at Manchester Met and your professional background, please?
I can. So I'm Jane, and I've worked at Manchester Met as a senior lecturer for 2 years full-time, and I teach across the undergraduate and postgraduate programme, but with a musculoskeletal bias. I previously worked as an advanced musculoskeletal physiotherapist for about 15 years in the NHS before I joined Manchester Met as a full-time lecturer. And during my clinical years, I worked as an associate lecturer at Manchester Met teaching on the MACP pathway. So prior to my full-time role here, I was an advanced practitioner in the emergency department, and to kind of enhance my role there, I actually undertook the MSc in advanced practice at Manchester Met.
How was it working in the emergency department?
Yeah, it was good. Very hectic, very busy, lots of thinking on your feet, quick decision making, but probably in my 4 years in the emergency department, learned more than at any other time in my entire kind of 24-year-long physiotherapy career.
How did the course at Manchester Met help you within the emergency department then?
So I think there's two main things really. So the first part of the course I did was the MACP route, and the sort of advanced clinical reasoning skills that I learned on that route, and that sort of really taught me how to problem solve with a patient, and often in really kind of complex cases of things that you had to consider lots of different potential diagnoses. So it was the clinical reasoning, decision making that was really helpful. But then as part of the advanced physiotherapy module, it was the kind of things that I learned about being able to interpret imaging and recognize things on x-rays and MRI scans, and also interpreting patients' blood results as well. So in the emergency department, a lot of the stuff that you're doing is kind of excluding complex and more serious things that you need to kind of be aware of, sort of the images and the blood tests and all of the other things that go along with your more traditional physiotherapy role.
Sounds good. Diane, would you be able to give us a bit of background about your career, your role at Manchester Met, and also your career to date, please?
Yeah, okay. So similar to Jane, I've worked in musculoskeletal practice. I still work in practice at the moment. I started my work at MMU about 2.5 years ago as part of a secondment between the collaborative partnerships with the sort of local employers. So I work for Manchester Foundation Trust, and it was part of a task and finish group with Manchester Met, Northwest Ambulance and Manchester University Trust to develop the collaborative Advanced Clinical Practice Masters Apprenticeship Programme. So as part of that programme, I was seconded from my NHS work to come and develop that at MMU along with other colleagues. I've since become a permanent member of the team, working as an associate clinical fellow in advanced clinical practice. I still teach on the Advanced Clinical Practice Apprenticeship Masters, teaching the musculoskeletal components there. I lead the injection therapy and work on the musculoskeletal medicine upper and lower quadrant programs. So my background, a bit like Jane, I started a modular route really to advanced practice. I studied my first module in 2000, so 20 years ago now is when I started my injection therapy module at Manchester Met. I then went on to do advanced musculoskeletal practice, where, like Jane says, you learn to begin to look at diagnostic imaging, blood tests, develop your clinical reasoning at level 7 practice, so using the evidence base. And then I did a master's in trauma and orthopedics, followed by some prescribing. So I did supplementary prescribing at Manchester Met, and then a conversion course later when the regulations changed. Since sort of done teaching qualifications, so working across the 4 pillars of advanced practice. And in my day job, my other day job, Manchester Foundation Trust, I work 3 days there. I am in a musculoskeletal interface service. So we see people between secondary and primary care, and I also work as a musculoskeletal transformation clinical lead. And that's what I do today.
Has a lot has a lot changed recently in terms of obviously your current situations with working in the Manchester 3 days a week?
Yeah, so obviously this year with the COVID-19 pandemic, we've had to move from face-to-face consultations to a much higher proportion of virtual consultations. So presently we're 70% virtual, 30% face-to-face. So that's brought challenges because rapidly we've had to learn how to use the technology. We've had to learn how to safety net in a virtual platform, because normally we'd use our objective skills to confirm our diagnosis. So we've had to have a much sort of greater threshold for questioning, so really sort of using our red flag questions. So yeah, it's been very, very different. And resultant massive waiting list now, unfortunately, as well.
Yeah, it's a massive challenge.
Mm.
We're going to go into a bit more of the FCP part of this now. So could you give us a brief overview of the FCP role, please, the first contact practitioner role?
So the first contact practitioner role, these have been developing roles over the last few years, and the first contact practitioner role is a diagnostic clinician who has highly developed complex clinical reasoning skills, and working in the primary care at the front of the patient pathway. So these started a few years ago in many pilots around the country, and this was in response to a reduction in GP numbers, and therefore they looked at different ways of working and found that a high percentage, 1 in 5 patients consulting are in primary care have musculoskeletal problems. So they, as physiotherapists, we are musculoskeletal experts, and therefore we were able to step into this role. But this was initial pilots, and it was found there was lots and lots of benefits. Patients were being seen by an expert in MSK care right at the front of the pathway. They were getting more timely advice about exercises, condition management. It was keeping people in work for longer. It was found that there was reduced numbers of prescriptions, reduced number of diagnostic tests, reduced numbers of referrals onto secondary care. So lots and lots of benefits for first contact practitioner roles. As a result of that, a change in the GP contracts, there's now a vision for creating many more of these roles over the next 2.5 years in primary care. The GP contract has a scheme called an additional roles reimbursement scheme, and they want the primary care networks to have 100% coverage of MSK, FCPs and other FCPs in the next 2.5 years. So there's a big shift. Alongside this shift, though, it's been shown that there needs to be sort of standardization, high quality care, and clinicians that meet the capabilities and requirements of the first contact practitioner role. So excitingly, Health Education England have developed this robust framework. It's a first standardized pathway defining the capabilities and the expertise of the people needed for first contact roles. So we've been doing a lot of work at Manchester Met, sort of mapping all of the programs that we have here. So and that's a lot of the work we've been doing to date.
What is the difference between like an FCP and like a normal general physiotherapist?
So a general physio, we have different grades. So when they first qualified, a physio works across all the body systems. So at undergrad level, they're talked about musculoskeletal, but also neurology, respiratory care, cardiology. So many different body systems. And initially a physio will develop those skills when they first qualify, and they'll rotate into different clinical areas to really hone that multi-body system assessment assessment. And then as the physio becomes more experienced, they usually choose to specialise in an area, and they can specialise in musculoskeletal area, and then they start to further develop and embed their clinical reasoning skills, and that happens over time with clinical mileage, with education. So an FCP, by the sort of definition of the new framework that's come out, is defines that somebody who has worked 3 years static in the musculoskeletal practice is at the front of the FCP pathway. They can then start to develop their first contact practitioners, further develop their skills. So a first contact practitioner, how that's different is we talk about levels of practice, and there is a multi-professional framework for England for advanced clinical practice, and this was released about 2.5 years ago. And this framework is the first framework to provide a standard definition of advanced practice, but it also defines the capabilities of that role. And we talk about advanced practice being in 4 pillars. And the pillars are sort of clinical, leadership, management, education, and research. And these 4 pillars are shown for advanced practice at level 7. So for an FCP is someone who is developed their level 7 clinical pillar. So that means they're able to use complex clinical reasoning skills, complex decision making. So the FCP, when you start to develop that, that's what you're developing your clinical pillar. You're still working on your other pillars, but not at that advanced level, level 7. And obviously for primary care, for FCP, they also have to do other primary care capabilities, like personalised care, shared decision making, fit notes, and those sorts of things that we'll see in primary care.
So the first contact practitioner role, after, if they wanted to move up through that, what would be the next step in their career after doing the first contact practitioner?
By definition in this new roadmap, so they will have developed the level 7 clinical pillar. The level 7 clinical pillar for the first contact practitioner is not the same level as it's same academic level, but the depth and the reasoning develops more for the advanced level. So it's a bit more into the level 7 pillar for the advanced practitioner. So to be an advanced practitioner, you need to develop more of the other pillars. So these are leadership, management, education, and research. So as part of the apprenticeship and the advanced practice masters, all of those 4 pillars are covered in that. So somebody could do a multi-professional the advanced clinical practice multi-professional program and meet those 4 pillars, but you can do other modules. We have standalone modules for sort of leadership and research methods, and I think some of those fit in the MACP. So to develop to be an advanced practitioner, you need to do some of those other modules, and the skills of the advanced practitioner is more about sort of leading. It might be they're doing sort of service development, quality improvements, sort of research, auditing, service evaluation, and those are the additional sort of skills for more rounded. So that will be the sort of next aspiration. And then for musculoskeletal advanced practitioners, then we've got as Jane said, the sort of the additional musculoskeletal advanced practitioner capabilities, which are not out yet, but we know because we have Jane sits on the MACP committee, and I sit on some advanced practice committees, so we know that those capabilities that are coming out for advanced practice are the ones that map to IFOM, which is part of the MACP pathway. So really within MMU, we have modules that will cover right from for a physiotherapist, really from band 5, 6. So at the start of their FCP journey, they can be on one of our many programs or our modular programs, and developing those skills, those clinical skills, the leadership, research, management skills, and those advanced MSK. So for the new roadmap of which is the first time we've had a sort of a career pathway for MSK physios, physios. We have a pathway for MSK physios where they can start with us at band 5-6, developing their MSK right through, if they stayed with us, up to developing to the advanced practice MSK capability levels.
That's one of the beauties, I think, of what we have on offer at Manchester Met, because we've got units there that can support a practitioner throughout their career. We've got units that support foundations for effective leadership and management, which fulfills the leadership and management pillars of advanced practice and helps you to work within an organisation as a manager, as a leader. But then also we've got a really active research department led by Professor Sell, Professor Callaghan, Professor Littlewood, that are kind of eminent researchers in musculoskeletal medicine. So there's opportunities really to work with experts in their field to help to develop research projects or quality improvement projects alongside the other things that you might be wanting to do within your career. So, like the injection or non-medical prescribing, or the advanced practice where you get to, learn more from experts about other conditions, so rheumatology, and we have radiologists that come and teach and looking at interpreting blood, so it's more advanced diagnostics than you would maybe do as you sort of a band 5 or a band 6. It's as you're moving up that ladder of physiotherapy, and the beauty is that you can tailor those units to your own personal needs and requirements and what you want to do with your career. And sometimes people do it like Diane and myself, where we did like a module here and there and then gradually developed it into a master's that suited us. Or you can sign up from the beginning and just go start to finish without having any breaks in between. So it's really flexible for lots of different career pathways.
So there are different routes into the FCP within Manchester Met. Can you just give a brief overview of those, please?
Yes, so the new FCP roadmap that's come out from Health Education England, which defines the educational pathways along as with the capabilities to become an FCP, talks about a couple of routes. One could be via a portfolio route, so you're using your experiential learning at level 7 to demonstrate you meet the clinical capabilities at level 7, along with doing some primary care e-learning modules and a portfolio sign off in primary care practice, so with the GPs and trainers in primary care. The other way is by doing a HEI FCP module, and at MMU we have the Advanced Musculoskeletal Practice module, which meets the capabilities described from the first contact musculoskeletal capability document. So this maps to all of the capabilities from that document. We've included in that primary care day, so we have somebody who teaches around issue of fit notes in practice. We also have a GP with special interest talking about experience in primary care, along with diagnostics, advanced diagnostic studies, hematology, rheumatology. So that module maps to the first contact MSK capabilities. So that is a route that people can take, and they would need to do the additional e-learning modules for primary care, which are there's an eight section module which is just for primary care, FCP, and also personalised care, and then again a portfolio sign off in practice. So they're the different routes that people can do. It's really important, and these are changes that are happening. So this is where the importance of sort of level 7 studies are shown, is that the at this stage, anybody really can work in a first contact practitioner role in a GP practice with a specific requirements of what that GP needs. However, the definition and the role is becoming more standardized, and because the capabilities have now been identified, for people to call themselves a first contact practitioner role, they're going to have to be able to show that they meet all the capabilities and that they're signed up and verified on the new Centre of Advancing Practice from Health Education England. So all of our programs will meet those capabilities. But the Centre of Advancing Practice as well is going to have a section for advanced clinical practitioners or advanced musculoskeletal practitioners. So again, everybody is going to have to demonstrate that we meet the capabilities and that we're registered to be able to use that sort of title, which is a new change. So doing these studies at MMU gives them that level 7, which supports their portfolio routes if they choose to do training that way, and they'll be able to use all that evidence to upload to the Advanced Practice portal to demonstrate their level either as an FCP level 7 or an ACP across the 4 pillars.
Jane, then, would you be able to give a bit of an overview of the MACP pathway and how that links in with the first contact practitioner units, modules?
So the MACP route looks more at kind of advanced clinical reasoning skills in the assessment, the diagnosis, but also the management of patients with potentially complex musculoskeletal disorders. So we're looking more at, so for an FCP role, you wouldn't be getting so involved in that part of your role in the management of patients and the rehabilitation of patients. You'd be more kind of developing their diagnostics, their assessment skills, and then maybe signpost into other services to progress management wise. But I mean, I think a number of first contact practitioners that I know that have come through our course maybe work in a first contact practitioner role for part of the week, and then the other part of the week they maybe work in a different type of role. So it might be in like an advanced rehabilitation or in a physiotherapy department, or maybe in a secondary care clinic. So they may be working alongside a multidisciplinary team of, say, surgeons or nurses or different practitioners. So in that way, they're sort of working within those 4 pillars of clinical practice, as well as the kind of the detail of the musculoskeletal management of conditions that we look at in the MACP route. And the good thing about the MACP route as well, I think, as far as I'm aware, it's the only master's unit that we have, and it's quite rare to have actual clinical placements associated with that. So we have a couple of units where you with clinicians in practice on like a mentorship module, really. So you're getting that hands-on clinical experience as part of a university unit, and that's quite rare in master's education. And the feedback that we get from our students is sometimes that's almost the bit where they learn the most, where they can kind of really properly translate those skills that they've learned as part of their university academic work, and they can really kind of focus on developing that in clinical practice with their clinical mentor. But I think another thing as well is you can, if you want to do your full masters, you can do MACP route, and you can do the advanced musculoskeletal practitioner module as an extra module. So to get the full number of credits before you then do your research methods and dissertation, there's another kind of optional unit that you can do, and that's what I did. I did the MACP route with the advanced physiotherapy practitioner module kind of attached to it. So that worked really well to fulfill the sort of criteria that I needed for all of the roles.
I've been reading a lot of student testimonials actually recently about the advanced physio and the clinical placements, and they've all said that that's, even though it's the most challenging part of the course, it's also the bit where they can put in the skills they learn in a lecture theatre or on a Zoom call into practice, really.
Yeah, definitely. And we have students that go and work with first contact practitioners or with advanced physiotherapy practitioners as part of their clinical placement. So it may be that it's a student who's working as a musculoskeletal physiotherapist, and they're kind of striving to a first contact role or an advanced practice role, and it's an amazing learning experience for them to be able to develop those skills that they've learned in academia in practice with a kind of well-established advanced physiotherapy. first contact practitioner or whatever.
What does the MACP stand for then? What does the accreditation?
So the MACP is the Musculoskeletal Association of Chartered Physiotherapists.
And what does that accreditation or approval mean for students?
So really, the MACP is the thing that that aligns you to IFOMP. So it means you're part of an international community of musculoskeletal advanced practice. And the MACP is the sort of the largest musculoskeletal. I suppose it's almost just a body or a special interest group, I suppose, in the UK, but also globally, really, because there's lots of other organisations that all kind of come under the IFOMP umbrella. So it's quite regulated. You have to kind of, fulfill specific criteria to be able to align yourself to the MACP standards to then, for your kind of master's degree to then give you that membership of the MACP. So it's and the MACP have their own sort of continuing professional development and oversee MACP pathways throughout the UK universities that deliver that. And I sit on one of those committees. The benefit of having the MACP pathway as one of those options is that it is the pathway that maps to the IFOMP criteria, that map to the Advanced Clinical Practice Academy criteria framework thing. So that work's already been done. So it's just about putting those things in place now to enable our graduates to then, be eligible to apply to become advanced musculoskeletal practitioners, and it helps to develop that pathway through from FCP to advanced practice, but also in rehabilitation and patient management as well.
So Jane, who is the MACP pathway designed for, and what sort of students are you looking for to come onto the course?
So the MACP pathway, we tend to attract people who want to develop their specialist skills in musculoskeletal diagnostics and assessment, but also in kind of advanced management skills. So it's progressing the patients through the sort of evidence-based management, including some manual therapy, including some exercise, rehabilitation, and it's really kind of homing in on their clinical reasoning skills and their ability to critically appraise the evidence and put that into practice. We talk a lot about 3 pillars of evidence-based practice. So we want to make I suppose it's striving for patient-centered care, but using the best available evidence, your kind of clinical skills as a physiotherapist, but also the patient's sort of goals, feelings, and their sort of personal requirements. So it's looking at kind of advancing skills in that, really. So it's usually people who work in musculoskeletal practice. There is a sort of expectation that in order to fulfill the MACP route, you need to be working in musculoskeletal practice full time, because we want people to bring their clinical experience into the classroom so we can discuss cases. So often it is people who are striving to work in advanced musculoskeletal practice. So it could be suitable for someone who wants to be a first contact practitioner if their speciality within the GP surgery or the primary care centre is musculoskeletal, but also for people who want to develop advanced musculoskeletal skills. So my kind of previous clinical role was before there was such a thing as a first contact practitioner, but I worked as an advanced physiotherapist in the emergency department. So looking after any sort of complex musculoskeletal or orthopedic cases that come through the emergency department, but then also working in secondary care in orthopedic clinics or spinal clinics, so neurosurgery clinics. So it's just developing those more advanced skills as a pathway to musculoskeletal practice.
I'm going to go into more about Manchester Met now. So why studying at Manchester Met? So
we have some really kind of well-known and well-recognised professors of musculoskeletal medicine within our department. So we have Professor James Self, who has done a lot of work along Cauda equina syndrome, red flags, works with Sue Greenhalgh, who's one of consultant physios, who's one of our clinical fellows, but she's also a consultant physio in the Greater Manchester area, who's developed lots of resources and research to help clinicians in practice, so GPs, first contact practitioners, and everybody really, to recognise red flags of some particular conditions, so particularly cauda equina syndrome, but also there's a lot of international collaborations around spinal infection, and that James Self's team has worked on clinical frameworks for recognising red flags in clinical practice. So they're the people at the forefront of the sort of knowledge that we need in these kind of advanced or first contact roles, to ensure that we're, timely management of patients that maybe have red flags of more serious pathology, so that, we don't miss things, and we can develop these kind of complex clinical pathways to ensure that patients get the services that they require in a timely manner. And then we also have Professor Mike Callahan, who does a lot of work around osteoarthritis, particularly of the knee, the patellofemoral joint, and works with has lots of collaborations around identifying people who are maybe more at risk and how to manage conditions. And then we have Professor Chris Littlewood, who his kind of area of research is more around complex shoulder pathologies, and he kind of has a team of researchers that are looking at rotator cuff related shoulder pain or rotator cuff tendinopathy, and that there's lots of kind of large collaborations and studies that are going on around comparing physiotherapy interventions to surgery, and looking at different outcomes and different or more effective and efficient ways, I think, of managing these patients that we sort of see every day as part of our musculoskeletal practice. And then Jill Yowell and Sue Greenhalgh have been doing a lot of work recently around the first contact role. I think they've had some collaborations with the Chartered Society of Physiotherapy to do some qualitative research really as well, to look into the experiences of physiotherapists that are working in first contact practice roles within the UK. So for me, one of the big benefits of Manchester Met is to have these amazing researchers on your doorstep, and they're all so approachable that, if you have a really silly question, you can just ask them and they'll get back to you. And if you want to get involved with stuff, they're always open for collaborations or advice if you wanted to develop a particular research project of your own as part of your master's degree. There's lots of people around that can sort of give you support and advice, or maybe get you on their team to help with some collaborations as part of your own research. So it's just such a kind of fast moving forward thinking team, that it's an amazing place to be as a musculoskeletal specialist.
Has it got a bit of like a community feel vibe around the physio department?
Yeah, definitely. And I think even though that we're all working remotely at the minute, the research team are working really hard to keep us all interconnected. They run sort of daily drop-in sessions and have like monthly meetings where people come and feed back. We have clinicians in practice that are doing their PhDs or master's dissertations within the Manchester Metropolitan department, but that come to our meetings and present back, and we're collaborating all the time, aren't we, Diane, with people in practice to help them to develop their own research projects that are kind of pertinent and relevant to them, particularly in the sort of COVID pandemic situation as well, and remote working.
I was going to ask if the research that is done within the department, does that impact in the curriculum?
I mean, absolutely. All of the units of study that you see in our portfolio are evidence-based or evidence-led. So we're always, whenever we're always trying to keep abreast of any new evidence that's coming out around the topics that we teach, and we embed that continually into our programs of study. So where we can, we try and get our professors in to do some teaching within the units to kind of help us to keep up to date and abreast of what they're doing that's kind of relevant to each particular area. So we have kind of Professor Self and Sue Greenhalgh, and they all come and do little bits of teaching within our units of study, just to ensure that our students have the opportunity to hear it from the horse's mouth, as it were, I suppose, and ask them questions related to their own clinical practice.
I think to finish off then, I know Diane, you touched on this before. I'm going to talk about the future of the FCP role now. You touched on it before with 100% coverage in GP surgeries, but what do you see the future beyond that for the FCP role being? Why is it an exciting time to be in that role at the moment?
So it's an exciting time, the FCP role, because it's just really just developing. So they had pilot areas probably about 5 or 6 years ago, just in small numbers of GPs, GP practices that were shown to be really, really effective. And then that's caused a transformation in musculoskeletal delivery. So as part of that, and because primary care numbers with the population are becoming older, so the MSK numbers are increasing, people with MSK conditions have more comorbidities than they may have done years ago because of that. And reduction in GP numbers, where we know there's a high number of consultations in primary care for MSK, is why the whole pathway is being looked at and redesigned. So the GP contracts changed, and like I say, there's funding for something called these additional roles. And we talk about a primary care network, which may be a network of, say, 5, 6, a few GP practices, and they cover maybe 50,000 patients. So the GP contract want 25% of their primary care network covered with FCPs by April 2021. And then they want 75% coverage by 2022, so 18 months later, and 100% coverage another 12 months after that, so in 2.5 years. So it's really, really exciting for MSK practitioners, because this new role, where we need lots of numbers of clinicians working at this high level, has been sort of created. Alongside that, Health Education England, along with other partnerships, the MSK partnerships, have developed the capabilities required. And the first time that we've ever had an educational pathway for musculoskeletal practice from our band 5s, which are immediate postgrads, to our advanced practitioners and maybe even consultant practitioners. So it's the first time we've actually got a defined pathway with clear lines of clinical competencies, capabilities that need to be achieved, and actually what we need to put in place to achieve them. That's the first time we've had that. So it's really, really exciting for these clinicians. And the other thing that I think is really exciting is that to become an advanced practitioner in the way Jane and I have done it over many, many years, like Jane's, you know, we're both way over 20 years in practice, way over, and it takes a long time to get to advanced practice. Really, it has done over the years, and it's different for some of the other professions, but in physiotherapy it'd be something we developed and eventually you get there as you develop your skills. But actually the first contact practitioner pathway now, a clinician or an MSK postgraduate clinician, when they've done 3 years static in MSK, are at the beginning point of developing their FCP skills. So the actual advanced practice and the FCP pathway has moved much sort of quicker for them. So they'll be able to develop much more quickly with a clear career pathway, with clear educational and clinical skills that need to be defined. And alongside that, MMU, what we've got is all the modules that cover the whole pathway, so that they can develop, and it's a clear pathway. So it's really, really exciting. And I think the numbers in primary care are just going to, like I say, I think 26,000 first contact practitioner roles are wanted in 2.5 years' time, by April 2023. They're not all MSK physios, but certainly the first wave are MSK physios. So yeah, it's really, really exciting times.
Thank you, Jane and Diane, for joining us today.
Thanks so much. Thank you.